Hi, my name is Carrie Sand. This is my Week 9 presentation for Nursing 612 at Maryville University. This is my volunteer patient. I'm going to ask her what brings her in today.
Migraine headaches.
And this is the patient describing in her own words how she is feeling. I can look at old charts, but today I'm going to talk to the patient. Can you tell me about the onset of your headache?
They're always in the morning.
And can you tell me about the location of the headache?
Always on the right side of my head.
And what about the duration? How long do your headaches last?
1 to 3 days.
And are there any characteristics that go along with the headache?
I usually get nausea and vomiting.
And is there anything that aggravates the headache?
It seems like bright lights, a lot of noise seem to make them worse.
And does anything alleviate the symptoms?
Maybe a little if I can get to a dark, quiet room.
And what about radiating or regional pain? Do you have any?
Yeah, it goes down my neck and into my shoulders.
And what about temporal pain?
Always in the morning.
And the severity of the pain, if it was on a scale of 0 to 10, 10 being the worst pain, how would you describe the pain?
10 and always throbbing.
And then we would discuss past medical history to gather more information. Can you tell me when your headache started?
In childhood.
And do they interfere with your daily activities?
Yes, I often miss work.
And have you ever been hospitalized?
Yes, 1 to twice a year in the past few years since 2011.
And are you allergic to any medications?
No,
Are you currently taking any medications?
only over-the-counter ibuprofen for my headaches.
Are you getting any relief?
Very minimal.
And then we would talk about immunizations. Are your immunizations up to date?
Yes,
Have you ever had any head injury or trauma to your head?
no,
Further, we would discuss family history to gather more information. Is there any history of cancer in the family?
yes, my mother and my daughter. My mother had lung cancer, my daughter had breast cancer.
And what about diabetes?
My father,
High blood pressure or hypertension?
my father and my sister,
Any blood disorders in the family?
no,
What about seizures?
no,
Epilepsy?
no,
Thyroid?
no,
Alzheimer's?
no,
Any renal disease?
no,
Respiratory disease?
no.
Any other headaches in the family?
My mother,
Then we would discuss social background to gather more information. Can you tell me if you're employed or retired?
self-employed,
And what does your job entail?
physical activity, moving boxes, building trade show displays, computer work, working on the website, filling orders,
And what do you do for activities?
watch my grandchildren.
And do you smoke?
No,
Do you drink alcohol?
no,
Any recreational drugs?
no,
Any caffeine?
yes.
How much or what do you drink?
1 to 4 cups of coffee in the morning, maybe 2 to 3 glasses of iced tea during the day.
And what else do you drink during the day?
Water,
And how would you describe the level of stress in your life?
high.
And what about your living environment? Where do you live?
I live in a house with my husband in a retirement community.
And do you exercise?
No,
So we could talk about even starting to walk a couple times a week up to 30 minutes. And what about your diet?
I think I eat a well-rounded diet, leaning toward low fat.
And then we would do a full review of systems, but since we're limited on time, we won't do that today. And then I would ask my patient if there's anything else she would like to discuss today.
No.
Okay, and I would say thank you.